Thank you very much. It's great to be here. And thanks to everybody for joining in to listen to the rationale and plans for this research that in part was kind of co-designed here at CanCOVID. So I'm going to be talking about using technology to keep women and children who are living in households characterized by violence safe during this CanCOVID pandemic. And just by way of background, very brief background, I am a professor of public health at the University of Toronto. I have a Canada Research Chair in population health intervention research, and I'm a scientist at the MAP Center for Urban Health Solutions at St. Michael's Hospital. And I have been doing research in the area of partner violence for 25 years. So for those, very briefly, who don't know much about partner violence, I'll start by saying that the prevalence of partner violence is quite high. About 1 in 3 women will experience violence in their lifetimes, and it's higher than the prevalence for some of the top Canadian diseases or even killers. So, for example, the prevalence is higher than diabetes, heart disease, breast cancer. And so, sadly, though, partner violence does not get the kind of attention that those other conditions receive. The COVID pandemic has magnified the problems that contribute to partner violence. And so there are reports from dozens of countries that violence is on the rise. Now, it isn't that we're actually measuring the incidence of violence in these countries. That's actually very difficult to do with or without COVID. But we hear about proxies, such as the number of calls to either police or to service providers, which have been noted to be on the rise everywhere, as well as femicide, which has been also reported to be on the rise. Every day, there are new media reports about the increase in violence against women and children due to households being confined to the home while the pandemic unfolds. And this pandemic has magnified those factors that contribute to the risk of partner violence, making the home unsafe for those who are living with abuse and violence. So I'll give you some examples about what's been unfolding. The COVID pandemic has caused an economic recession with millions of jobs lost or individuals experiencing involuntary reduction in hours worked. These statistics that I'm showing you on the proportion of jobs lost by hourly pay were released Friday, and they reflect what's happened in the last 2 months alone. And you can see the inequalities caused by the economic downturn. These data identify those households that will be most impacted by the increased stress from financial strain and also the risk of violence. And so add to that the reduction in services and closure of schools, which are a source of supports for women and children living in households characterized by violence, and taken together with the requirements to stay confined in the home, this magnifies the stress in households. Shelters are not really an option for women living with increased stress, in part because of overcapacity issues at shelters, and also the risk of COVID infection from the inability to easily do physical distancing makes women more hesitant to seek out assistance from shelters at this point. So this is actually not a very unique situation. There have certainly been other types of epidemics where there have been the combination of, an infection and an economic downturn leading to similar situations. I think this has happened rather quickly, though. In that sense, it's unique, but it's not exclusive to COVID. For example, other public health emergencies, such as the Ebola outbreak and epidemic in 2014 in Western Africa, also had people confined to the home, and there was an increase in violence against women and girls documented at that time. So I think the question is, how do we reach women safely? Here in Canada, many of us have access to the internet, and it's been documented that since March, internet usage is way up as we're confined to the home. And so technology might be a good way to allow women to access information about how to keep safe during this pandemic. So I want to tell you a little bit about a suite of apps that we developed. They were co-created with partners who serve the population of women who are living with partner violence. And also we included women with lived experience as we were creating these apps. There's two apps, and they're both publicly available for anyone to use, any place and any time. The WITH in With Women stands for Web-Based Innovations Targeting the Health of Women. And these apps, there's actually two of them, as I mentioned. One of them focuses on creating awareness about problematic patterns of relationship behaviors that are unsafe. It's kind of a screening of sorts, but it's self-screening, or you can screen for a friend. I actually don't want to spend too much time on discussing that app because really the subject of this research is with that second app, but I'm happy to answer any questions that you might have about that screening app. And so on the right side, you'll see the contents of the Pathways app. Pathways is more complicated than the one we're focusing on for this research. And you can see by these icons that there are many components. So for example, there's the danger assessment that's done in this app. There's personalized safety planning. You rate your needs, and safety planning activities are presented that align with your articulated priorities. The Pathways app, while it was co-designed with our partners and women with lived experience, has its foundation in another app that's been demonstrated to be effective in safety planning in several randomized trials called MyPlan. And so we retained many of the features of MyPlan in our app with the permission of the designers of MyPlan. And we tailored it to our local context with the help of service providers and women with lived experience locally. And this app then has the features from MyPlan to help women make better decisions around safety planning. And in that sense, it is evidence-based. So both these apps have lots of safety features. You know, our original web-based Pathways app, for example, includes, you know, the quick exit bar, and it'll hide the website if needed. It's designed to leave no trace on your phones or on your computers. So sounds like it's really the way to go. Not really though, because one of the limitations of the With Women Pathways app at this moment is that it does not have safety planning content that is appropriate for a situation of a public health emergency like we are facing now with COVID-19. I think this brings us to the research that our team is proposing. So I just want to share with you a list of the investigators on this team. And as I mentioned, we found many of them through CanCOVID. We advertised what we were planning on doing, and we had some people come forward and join us. So it's going to be even better research now that we have some more people with unique talents on board. So for the research itself, we actually have 4 kind of activities that we're going to undertake. The first one is around safety planning, because there are a few safety plans that speak to the specifics of our COVID COVID-19 public health emergency, we're going to compile that information, and we'll do so by working with a number of community-based service agencies. And also we work with women with lived experience to ensure that the strategies that we do identify make sense for the population that we are going to work with. We draw from the latest and the past public health emergency experiences as well. And we're going to bring all of that together and work with our partners and synthesize the information into a set of safety practices that are appropriate for the unique features of this pandemic. For example, being at home, not really able to leave, and then living at home with the perpetrator. So our first phase then is to gather and synthesize the evidence that does exist, conduct interviews with individuals, and come up with a set of modified safety practices that are appropriate for the COVID-19 epidemic. The next phase is going to focus on our app then. Take our Pathways app and swap out that content around safety planning, and we'll put in the modified strategies that were generated in phase one. So I think that it's going to take a matter of weeks to kind of swap out that content, because we're also going to look again at some of the safety features to see if there are ways to improve it. So we actually hadn't designed the app to be used in close proximity to others, and maybe in close proximity to the perpetrator. So maybe there are ways in which we can better disguise the app. There are some apps out there for women who are living with partner violence that are disguised as a game or a calculator. And so we'll consider similar measures for our app as we're making the changes in the content around safety planning. And so once that content and the safety planning feature modified, we'll pilot it with a few folks before launching it broadly. And so I think for these first two phases, we hope to have everything finished within about 3 months of starting our project. So the third activity that we're going to do is to launch a social media campaign about the apps. We need to get the information out there, and since a lot of people, again, are at home and are on the internet, we thought a social media campaign would be a great way to get the information out there. Our target audiences are not only women who are at home living with violence, but also service providers who might want to know that this app exists, or that the modified safety planning strategies also exist. So that will be something that we focus on for several months after we have our modified app. Doing 4 activities, and I'll tell you about the 4th one. So again, our app, our modified app, is going to have the multiple safety features. It's going to be controlled by women to use pretty much any time. It's obviously available 24/7. And it'll have the modified COVID-appropriate safety plans as part of it. I didn't mention this yet, but our apps have actually been used in clinic settings. So for example, that first app that I told you about, the screening app, it's actually been used in healthcare settings, and it's something that has been called for many decades, screening in healthcare settings. However, few clinics have actually been successful in this area, often because there have been implementation challenges with screening. So for example, there's a number of barriers to providers actually asking about this. They don't feel comfortable, or they don't know what to do if somebody says yes. So the screening app has actually been useful, and when we put it in the clinic, we've seen screening rates go up to about 85%, which is pretty good. So we know we've been talking to providers, and they're looking for tools to help them with their patient visits, which are now virtual visits. So we're going to look for ways to incorporate these apps into virtual visits to help providers, screen for safety or screen for violence, or to steer them toward perhaps that safety planning app in order to help women promote safety confined to the home. So the fourth activity then is for us to develop a toolkit, and the toolkit will help healthcare providers and also social service providers incorporate these apps into their virtual visits. And so that is our fourth activity and fourth deliverable for this particular grant. So just to summarize then, this project is going to focus on safety plans for the use in public health emergencies, and we'll certainly disseminate that information even outside of the apps, but we will take that information and then put it into that With Women Pathways app, so that the app is something that women can access, hopefully discreetly while sheltering at home, to access that information on modified safety planning. And we will create a toolkit for providers, social service providers and healthcare providers, to incorporate the use of the apps to help them screen for partner violence and to help women get access to information around modified safety plans. So that's it for my presentation, and that was a quick overview. I'm happy to take any questions about what it is we're planning on doing.
Thank you so much, Dr. O'Campo. That was fantastic. If you want to stop sharing your screen, we can create a more conversational space.
All right.
We have a slightly smaller group today, so I certainly invite people to raise their hands if they would like to speak up and ask questions or make a comment. Again, I will also read out from the chat box, so if anybody has anything they would like to share or experience with the app, or questions or thoughts about the research, that would be fantastic. Please don't hesitate. Let me just make sure I'm all up. Yep. It sounds really fascinating, this app development. Do you work with a web developer also to sort of optimize your app? I'm sort of curious about the technology part of it.
Yes, we have a web developer who has helped us bring all of this together. So I think there are times when you go to a web developer and you have an idea and then they do it all for you, because the web developer that we went to had all those capabilities. But we wanted to do all of that upfront research with, again, our partners and then women we know who have lived experience. So we did all of that and took our ideas and some of our designs to the web developer, and they sort of did the rest. They did all the technology end.
That's great. In fact, it was a great presentation, and somebody was asking if we could distribute your slideshow. Is that an acceptable way to get the word about the app out?
Sure, absolutely.
Fantastic. So there you go, Carol Ann. Someone asks, will the recording of the, oh, nope. Sorry, that was a question about if this recording is going to be available, and it will be available on YouTube. This is such important work. Thank you, from Hallie. Do you also have considerations you can share for those who are developing more general technologies for COVID to ensure that they keep women and children who might be subject to violence safe? So is there application in this research in other areas related to COVID?
You mean, can we use technology, I guess, for, there were two applications here. One is for service providers and one is for women in the home. You know, I guess I should emphasize that I don't think this is the answer, right? So we need multiple strategies to reach and support this population. This is just one of many. I think technology holds promise. As I mentioned before, there have been many calls for screening, for example, in healthcare settings and potentially social service settings for screening for violence. And we know that one of the reasons it hasn't happened is because either service providers don't have time or they don't feel comfortable asking these questions for a variety of reasons. Women won't disclose unless they feel like they'll benefit from answering the question. accurately and truthfully. And so there's all kinds of challenges for screening for partner violence. And we were surprised at just how, I will say, easy it was for women to take about 45 seconds in the clinic that we went to at the hospital where I work to answer 9 questions. One of the benefits of our screening app is that it asks a fairly comprehensive set of questions about violence, the ones that we see that were already in existence, because we didn't necessarily set out actually to create these apps on our own. We would have loved to take another app and use that one, but they were fairly limited in the scope of questions that they were asking about violence because they wanted them to be short. I understand that, but we were able to get our questions down to 9. And we can see people filling it out and actually know the start time and finish time. So on average, it takes 45 seconds for women to answer these questions. And they come up with an answer and then an explanation for their level of safety in a relationship. So it is quite fast, and that information is available to the provider. And so they can incorporate that information into the treatment plan. Yeah, I think it holds more promise than I initially thought it would. So it's kind of exciting to see. But I also want to emphasize that it's not the only way to help women. We need a lot more services, a lot more money that goes to this sector because it was an underfunded sector to begin with. Yeah, I think there's potential for using this kind of technology.
And a point of clarification follow-up was, how can more general tech developers ensure that their apps don't inadvertently harm women and children who are subject to violence?
Yeah, I think that's a really great question. We did spend quite a bit of time on the safety features, and even then we've learned some more since we put the With Women Pathways app out. So there's quite a bit being published on this. And so I think reading the literature, learning from others would be really important.
Mm-hmm. And Carol Ann asks, what's the plan for advertising outside of social media? That you mentioned that.
Yeah, so this is one of those rapid response grants. And so we have focused on dissemination while everybody is, kind of still confined to the home, partially or wholly. And so that's why we did focus on kind of the internet and social media. But we are hoping that maybe service providers, if we can reach out to them, will put links on their websites to be able to either use it in their virtual visits, recommend it as a resource. So we're hoping through our network of connections that we can also disseminate it.
That's great. It's really an excellent project and critically important during the COVID pandemic, says Katie Muldoon. Is the app use anonymous, and what are the key metrics for evaluating the success of the app?
Yeah, great question. So yes, we have done a lot of work on really trying to figure out whether or not the app should retain any information about the woman, because she might want to come back. And, doing the safety planning doesn't take 2 minutes, actually. Even though the screening takes 45 seconds, the safety planning can take a while. And so we debated, for example, whether we should have women retain a code or a name and they can go back. But we decided to make everything anonymous and not to leave any trace whatsoever on a computer. So it is fully anonymous. And if she comes back 7 times, she's going to have to start over each time. And we'll get feedback on that. But so far, it has worked. In terms of evaluation, I mentioned that the Pathways app is based on an evidence-based model that exists. So the MyPlan app, we really borrowed heavily from the features in the MyPlan app, which has been evaluated in a number of randomized trials. So it didn't make sense for us to do a randomized trial. However, we are using fairly efficient experimental methods, single case experimental design, to do evaluations of our app and our modified app to make sure that it's as effective as the MyPlan app, the original app that we drew from. So we are doing an evaluation. and because we do want to make sure that it does make a difference in women's lives.
That's great. Someone in the chat box thanks you for the presentation and asks, do you plan to involve the end users, for example, the health professionals of your research in the course of the process?
Yes, we are going to involve them when we do phase 1, asking them about what their successes have been with some of the safety strategies that they have been recommending. So we're going to be doing some interviews around that. And then, of course, we are going to be involving them as we develop the toolkits, test the toolkits, and in the dissemination.
That's great. It looks like we're just reaching 4:30, and I think we've come to the end of our questions. So perfect timing, everyone. I want to thank you so much for sharing this very important work. I will post the slide deck on the CanCOVID Slack so that you can access it there. If anybody has any trouble with that, please reach out to me and I will happily make it available, because I think we should all try to disseminate this very widely to assist. This presentation will also be available on YouTube later, so check our YouTube channel for that. Thank you so much, Dr. O'Campo. Thanks for joining us, everyone.
Thanks, everyone, for joining.
Bye.
Bye.